Retraction cord, what is it and what does it do? Well, the whole purpose of gingival retraction cord is to temporarily displace the tissue and to widen the gingival sulcus. If you remember, the gingival sulcus is what sits around the neck of the tooth. The whole purpose of that is when the final impression is taken, the light-bodied material that is being used for the final impression is allowed to seep into that widened gingival sulcus in order to capture the full anatomy of that prep in order to make a really good and well-fitting crown. That is the whole purpose of crown and bridge, is to restore the tooth or teeth back to its normal function. And if there's a gap between the crown and the margin of the preparation, all because the tissue was in the way, then that's just going to lead to a lot of problems down the road for that patient. So retraction cord is going to be placed after the tooth has been prepared, and it's going to be taken out prior to the final impression. It can be done in a one-step or a double technique, and that's basically where you're either placing one cord in the gingival sulcus, or there may be a need to place two, and it's all going to depend on a lot of different things, and that's something that either the dentist is going to do, or they're going to delegate that to you if you are ETA trained. So retraction cord comes in different thickness, and it's depicted here by these numbers. So as you can see, the 000 is going to be very, very thin, whereas the number 3 is going to be very, very thick. It's going to depend on the condition of the tissue to begin with. It's also going to depend on the tooth or teeth that you're working on as far as what thickness you're going to be using or what size. Typically in the office, you're going to have 0s and 1s, and that's pretty much what we used most often, was 0 and 1. I never really used anything over a 1. On occasion, if it were an anterior tooth, I may use a 2. So with this retraction cord, it can come in 3 different ways. It can be twisted, it can be knitted, or it can be braided. Knitted is just a combination of the twisted and the braided. The twisted and the knitted cord is going to be a little bit harder to place because it has a tendency to fray, especially at the end. The braided is going to be much easier, and it's going to stay together much better than the other 2 types. Also with retraction cord, it can come as either impregnated or non-impregnated. Non-impregnated means that there is no chemical that it's been infused with. So retraction is completed by the force that is placed by pushing it into the sulcus using the special instrument that you're going to need to pack the cord. The impregnated retraction cord is going to be infused with a chemical. That chemical can either be a vasoconstrictor or it can be an aluminum chloride. You have to make sure that you're paying attention to what it is that you're going to be using, because if you're using an impregnated retraction cord and the patient has some health issues, especially heart issues, then that's a contraindication. That can actually cause a medical emergency to occur because of the vasoconstrictor that's in there. Just like we would not anesthetize our patients with the vasoconstrictor who has heart problems, we're not going to put a retraction cord that's also has the vasoconstrictor infused into the cord already. The whole purpose of that being impregnated is that it helps to control the bleeding. Oftentimes when the tooth is prepared, because they're getting down below the gum tissue, oftentimes it starts to bleed, and with it being impregnated with either the vasoconstrictor or the aluminum chloride, that helps to constrict those blood vessels and allows it to control the bleeding. It can also be done with the non-impregnated. We would always have a bottle of aluminum chloride in the office. I would dispense a little bit out. I would cut my cord to size. I would place my cord into that solution. And right before we were ready to take it out, I would take it out, kind of dab it onto a piece of gauze, and then hand it to the dentist to place. So again, pay close attention to what it is that you're using, and to always look at your patient's medical history, which you should be updating the minute they sit down in the chair anyways. So this is what the retraction cord looks like. We can see that these two teeth have been prepped already. This cord has already been placed, and this cord is in the process of being placed. This cord is going to be more like the braided type. Usually you could tell because the ends will usually fray out if it's going to be twisted or if it's the knitted type. This is going to be, like I mentioned, much easier to place. Another thing when it comes to retraction cord that you need to know is there's going to be a couple of different ways that retraction can take place. This is obviously going to be the mechanical retraction. Mechanical because it requires the use of an instrument and it requires material to actually remove the tissue away from the tooth. So this would be mechanical. There's also something called surgical retraction that can be done either through an electrosurge or by the use of a laser. And it's basically going to do the same thing. What's nice with the surgical retraction is it also cauterizes the tissue as it's taking away. That way it controls the bleeding in that way. Another type of hemostatic solution that can be used to help control bleeding that we would use not just for crown and bridge preps, but we would even use it when we did fillings, is something called viscostat. It comes in this yellowish color, and I believe it even comes in a clear color now. One thing I will say with this is you need to be very careful because this does stain. So if you happen to get it on you, definitely be very careful when you're putting it in the patient's mouth because you don't want it to fall on their clothing. So this helps to, the tip of this is somewhat like a brush, and you basically dispense the liquid out of the syringe and brush it into that area that you want to control the bleeding. You keep it in there for a few minutes and you rinse it off, and this works really, really well. So we would do this, use this for a lot of different types of procedures. So this is retraction cord. Make sure you know what it is, what it does, and its whole purpose.